afternoon, everyone. I do have 101, so we will begin today's briefing. This is Shelby Walker, Director of Communication and Media Relations. We will be hearing some comments from Tennessee Health Commissioner Dr. Piercy. Everything you hear today is on the record, and you may stream and/or record the briefing if you wish to do so. I will be sharing a link shortly in the chat to the announcement that we released earlier today for your reference. Dr. Piercy will be discussing those updates to eligibility during the comments today. We will have some time for your questions at the end, and we'll take them using the raise hand function. Dr. Piercy, we're ready for you to begin.
Thanks, Shelley. Good afternoon, everyone. It is my distinct pleasure to come to you today to talk to you about expanded eligibility for vaccine. You know, we've had vaccine available here in the state for about 3 months now, but we have been going pretty steadily through our phases and through our prioritization. But we are getting very close to a point where we can open it up to everyone, and that's the news we have for you today. So you will know, you've noticed about an hour ago that the governor dropped a video announcing expanded eligibility, and it really has 2 parts, and so I wanted to go over both of those parts with you. One of those is that immediately, technically as of last Thursday, March 18th, all Tennesseans age 55 plus and all of those in phase 2 of our vaccine plan are now eligible. So phase 2, that's both 2A and 2B, encompasses what we call critical infrastructure. There's a long list of those, and so I would refer you back to the plan, which is posted on our website, to get you through all of those categories. But essentially, think of things like public transit and commercial food production and other people in logistics and those things that are critical to the infrastructure of our society. Again, long list, check the plan on our website, but all Tennesseans age 55 plus and in phase 2 are now immediately eligible for vaccine. While I'm thinking about it, when I reference the plan, you know, we typically issue a plan update every time we move phases. We did that today, although there are not any real substantive changes. There are a couple of very small additions and corrections, but nothing of substance other than just an adjustment to the timeline. But you will notice that the plan update, latest revision was today. The big news today is that all Tennesseans age 16 plus will be eligible in Tennessee to get a vaccine no later than April 5th. Now, I said something important there that I wanted to make sure you caught. That is no later than April 5th. There are some counties where all residents of all ages are now eligible in that county. That's really good news because we want uptake to be as high as possible, and we want to remove all of the barriers that we can. Now, before I talk more about that, I want to mention something that you may have noticed that I didn't say. I didn't say anything about phase 3, and our vaccine plan does, as you know, have 3 main phases, 1, 2, and 3. We're all the way through phase 1. We just talked about phase 2 being eligible as of this past Thursday. But phase 3 is also a very important population. Phase 3 will be concurrent with all adults no later than April 5th. But let me tell you about how we're sort of taking special care of phase 3. Phase 3 are some unique populations that are very contained, like college campuses and corrections and other congregate living settings. It also includes grocery workers, which are a little bit more spread out, but for by and large, phase 3 are contained populations. So while we're not setting aside a specific time frame for phase 3, we will be directly allocating to a lot of those populations, so they will still get priority. They're just not going to have a specific time frame. And so, as we've told you all along, as supply builds and as we're able to, we will move through phases. But I hope this will be the last time I have to come to you and talk to you about phasing or who is eligible, because in less than 2 weeks, every Tennessean age 16 plus will be eligible for vaccine. So let's talk for a minute about supply. And as we've committed to you all along, as supply builds, we will continue pushing the phasing. But there's this very delicate balance of different areas of the state. I believe you recall me talking last week about how we've seen very wide discrepancies in all three grand divisions and even in different regions of those grand divisions of what uptake is, and in some places what it is not. As a reminder, in rural West Tennessee, less than 20% of our appointments are filled. But compare that to Middle Tennessee, and specifically what we refer to as the Upper Cumberland region, which is essentially the northern half of Middle Tennessee. Those appointments are over 80% filled. So, and everything in between. The Knox County and the Knoxville area region, that has a high uptake as well, but compare that to upper Northeast Tennessee, which has a lot lower. So it's really different all over the state, and it's a challenge to try to find the right balance of supply and demand. That's why we feel that it's really important for counties to be able to move at their own pace up to and including opening it up to all adults. On the matter of supply, we are expecting a total of 311,000 doses in the state this week. Now that does encompass both first doses and second doses. And then next week, we expect about a 30% bump in first doses. So I'm throwing out a lot of numbers here, but that will take our total next week up to over 350,000 doses. Now, what changed? You'll remember we had to scale back, or the federal government actually scaled back on our Johnson & Johnson allocation for the last couple of 3 weeks, and that is resuming next week. We expect anywhere between 50 and 60,000 doses of Johnson & Johnson beginning next week, the week of the 29th. And so that will take our total doses in the state for next week up to in excess of 350,000. As I mentioned, counties may move between phases at different paces. We have been posting that on our website for several weeks now. You can look to see which phase your county is in. But I also want to remind you that we don't constrain people by county lines. When supply was lower and the vaccine was a lot harder to come by, there was a lot of talk about vaccine tourism and people driving to different counties. And while we never prohibited that, it really wasn't expressly encouraged. That's less of an issue now. And so if people are willing and able to drive to different counties to get a dose, there are no restrictions against that. But no worries if there are people that aren't able to do that. And we understand that there are people with barriers to transportation or don't have the ability to drive or go across county lines. It's not a problem. We are going to supply your county very soon. All of the counties are currently getting their population-based allocation, and for the counties that are not able to exhaust those county allocations, those are being redirected to counties where there's more demand. So I also want to give you a final reminder that there is plenty of availability in appointments statewide. And I'm going to give you 2 websites that are really important. You've heard me talk about these before, but I probably refer people to these websites 5 or 6 times every single day. The first one, and one that I've been very impressed with, is vaccinefinder.org. This is a federally run website which shows all of the different vaccine providers in the state. Not only the public health department, but anywhere that has vaccine, it is on this website. The really neat part of this website is that you can choose the product or products that you are searching for. So if you only want Moderna, you can search that way, or if you want to look for all 3, Pfizer, Moderna, or Johnson & Johnson, you can sort it out that way. You can also sort it by the distance you're willing to travel from a certain zip code, for example. The other website is that of ours here at the state, which is covid19.tn.gov. That is actually where you go on and schedule an appointment if you want a vaccine at a health department. We continue to have over 500,000 available appointments statewide, and many of those are in counties that border metro counties, but not necessarily in the metro county itself. So if you are, again, if you're willing or able to drive to a different county, there are no restrictions against that. But you should be able to get it in your county of residence if that's where you want to stay. So I'm really glad to bring that announcement to you today. Like I said, I hope we don't have to talk about vaccine phasing anymore, because we're finally at a point where supply is opening up enough where we can make all Tennesseans eligible. So once again, all Tennesseans age 16 plus will be eligible to receive a vaccine in Tennessee no later than 2 weeks from today, which is April 5th. And before I conclude, I want to brag on my friends at Metro Nashville Public Health Department. As you know, they had an enormous event on Saturday, March 20th, where they vaccinated, at last count, 10,107 individuals at Nissan Stadium. And I don't have official confirmation, but I believe that is the largest single-site vaccination event in Tennessee history. And so I'm really proud of Dr. Gil Wright and Dr. Alex Jahangir and the hundreds of volunteers and staff, as well as the city and county metro leadership. They have done an excellent job, and it just so happened it was on the first day of spring, which was a great symbolism of a new awakening and a new dawn, and I'm really glad that we've gotten that behind us. So thanks for your good work, and I'm happy to take questions.
We do have some questions in the queue. We will begin with Caleb Hearn from WCYB.
Hey, Dr. Piercy, I wanted to ask you about the vaccine uptake issue. I'm wondering how much of this ability to move into new phases quicker than we thought is due to a lack of uptake, and how concerning is that we might not be able to perhaps reach herd immunity if not enough people are taking this vaccine. And if I could get a second question, I want to ask if you have any updates about community colleges and mass vaccination events you'd mentioned a few weeks ago.
Sure. So I wish I had better news for you, Caleb, on the uptake, but to be quite honest, one of the reasons that we are pushing forward on expanding eligibility is because our uptake has been lower than expected, particularly in our rural areas. And so that's to be expected. We anticipated some degree of that. Quite frankly, we did not anticipate to have such a low uptake in some of our areas. We understand that there's vaccine hesitancy, and we also know, because we've already seen it, that sometimes people just need a little bit longer to get used to the idea. They see their friends and family get vaccinated, and then they come around. That's understandable. But while we are having lower uptake levels, that means we have an excess supply. And you've heard me say for months now, the last thing I want is any vaccine sitting on a shelf somewhere. So we want to get that out to the people who want it, and create all kinds of open access and remove any barriers that we can. So related to herd immunity, you know, everybody always talks about, is it 55%? Is it 70%? Is it somewhere in the middle? We're not entirely sure. What we do know is that vaccine-induced or acquired immunity is a very consistent and surefire way to make sure you're protected against the vaccine. So, you know, education, those who are trusted healthcare providers, those are the types of people we need talking to the public at large to say, I know you may be hesitant, tell me what your questions are and let's work through those. So it's just something that we're going to have to continue working through as we move forward. Related to your question on community colleges, at the last update I got, there were at least 4 community colleges that were already signed up, and there were another 3 to 5 that were trying to finish their final preparations. And so we're looking at anywhere from perhaps 6 to 10 community colleges statewide, mostly in rural areas, because we've got a lot of availability and access points, if you will, in our metro areas. But sometimes in our rural areas, we're struggling to actually find enough providers to place the vaccine. And so I think you'll see those coming online very soon, and I look forward to making that announcement.
Thank you. Our next question is Kathleen Steary from Fox 17. Kathleen, if you're talking, you're still muted.
So sorry about that. Can you hear me now?
Yes.
Okay, thanks so much. Thanks so much for taking our questions. So, according to an article that was put out recently by the Associated Press, Tennessee, they listed them as among the bottom 10 for overall vaccine performance in the United States. And they cited that the rapid rollout of our vaccine program kind of backfired here and in other states across the country. What is your response to this? And do you think Tennessee rolled out the vaccine too fast to be able to handle it?
Hey, Kathleen, that's a great question that has come up in pretty much every venue we've been speaking publicly in over the last few weeks. And I think there are several reasons for that, but one is becoming very clear, and it's the one I just got a question on right before yours. So initially, I actually don't think there was anything wrong with the initial rollout. We were one of the leading states initially, but I think where you saw an inflection point in our state and in other states is that we had a very strong focus on equity and vulnerable populations. And by necessity, as you've read in the Washington Post and the New York Times, and you've heard me say on multiple occasions, there is a very well-documented trade-off between equity and speed. The other thing that I've said multiple times is I am wholly unapologetic that we slowed things down for the elderly and for vulnerable populations to go first. It was the right thing to do from a clinical standpoint. They are at higher risk for hospitalization and death, and it was the right thing to do from a societal standpoint. Was there a trade-off with speed? Absolutely. Then when you get moving, we started moving a little bit more quickly in early to mid-February, then the big snowstorm hit. And if you'll look back at the rankings, what you saw in around mid-February is that all of those states, mostly southern states, that were affected by the snowstorm really went to the bottom of the list. Again, to be expected, but over the course of 3 to 4 weeks since that snowstorm, what you've seen is not much movement in that, because those same southern states that are at the bottom of the list are the same southern states that are having significant issues with uptake, just as we are having. I speak with my southern state colleagues every Monday morning at 7:30. We spoke again this morning, and we're all seeing the same thing, particularly in rural areas, in areas where there are communities of color, low-income workers, and more rural conservatives. Uptake is lower, and so we were brainstorming on ways to change that. But as long as uptake is low, our rankings are going to be pretty low because we do not make this vaccine mandatory.
Thank you. Our next question is from Alexandria Adams with News 4.
Hi there, Dr. Piercy. Thanks so much for taking our questions. I just wanted to know, since it seems like the phasing system is kind of coming to an end here in the next few weeks, maybe months, we'll be able to start getting those vaccine appointments at our primary care physician visits.
Yeah, that's right. Great question. So right now we have, I think we're up to around 900 providers that have or will very soon receive product. We still have another 400 to 500 providers, most of whom, as you say, are primary care physicians, medical clinics, where we typically get our healthcare. Medical providers have it in their office, which ultimately is what we want. I don't know yet how often we're going to have to get this shot. If it's a one time in our lifetimes, I hope that's what it is, but likely we're going to have to get it at some interval. I don't know if that interval is going to be 1 year or 5 years or somewhere in between. But we eventually want to get this vaccine out into the general medical community to where it's just like any other vaccine and you don't have to have all of these special events. You just go to your doctor and get it.
Thank you. Next up, we have a question from Jacob Steamer with the Memphis Business Journal.
Yeah, thank you. I was wondering if you have any information about which counties are today or pretty much today going to all adults, and if you happen to know where Shelby County is in planning to move to that eligibility.
Great question, Jacob, and I will admit my knowledge is very limited and anecdotal right now. We just made the announcement about an hour ago. I do know that the Jackson, Madison County area went to all adults over the weekend. So I know they are already there. As you know, Memphis and Shelby County made a formal request of me last week to go to that. They now have permission to do so, and so that decision is up to them. Like I said, the Middle Tennessee, particularly the Upper Cumberland region, the Mid Cumberland region, as well as the Knox County region, may be the slowest to get there because their demand is still so high. But I suspect that within the next 24 to 48 hours, you're going to see a substantive number of counties go to all adults.
Thank you. Our next question is from Blake Farmer with WPLN.
Yes, thanks. I am curious about this issue of sort of rural conservatives seeming to be kind of the most hesitant, which I don't think is what folks were predicting early on. And I don't sense that any of these sort of like outreach plans have been super directed at them. Are you all, it sounds like you were talking to other state leaders this morning even, like, are y'all thinking about efforts to try to reach the rural white conservative?
Sure, great question, Blake, and one that I've sort of been surprised with as well. We already anticipated and understood the hesitancy in communities of color and in low-income communities. That was to be expected. The hesitancy amongst rural conservatives has surprised us some, and sometimes it's a little bit, at least we're hearing, it's a little bit different than what we're hearing in other groups of why they're hesitant. So we're talking to not only other states to share best practices, but we're talking to groups where a lot of rural conservatives tend to gather and get together and really dig down into what is it that's causing the hesitancy and how can we overcome that? In fact, we're doing some market research, just got an update on that this morning, across all 95 counties to drill down into that hesitancy and try to find those not so obvious reasons so we can address them. But I share your surprise, and it's something that we're going to have to sort of shift and recalibrate on.
Thank you. And I think we have time for one more question. We will take Kelly Roberts at WMC. Kelly, if you're talking, you are on mute.
Yep, sorry. Sorry about that. I'd like to talk a little bit about moving for those counties who are deciding to move into the next phase or allow all adults. We've talked about allocation. I mean, in a statement last week, you said, that they should be able to progress into phases if supply allows. If you see that there may be proof that supply isn't exactly allowing for certain counties to move into kind of all adults, even if if you see that maybe it's a hassle to get appointments or long lines, would the state intervene in any way if you see evidence that maybe the supply is not allowing for expanded eligibility?
Yeah, I mean, that's a great question, and one that we talk about a lot and have considered over the last several days while we were trying to make the decision that we announced today. Acknowledging the fact that this type of move is going to create somewhat of a logjam in some counties where demand is already high. That's part of the reason we're pretty adamant that counties move at their own pace with the goal of all adults eligible no later than April 5th, understanding that some counties are still going to have tons of availability and other counties are not. And so I don't envision a scenario where we'll ever pull back or where we will say, okay, well, we're going to have to scale back because demand's too high. I think the way to address that is to push vaccine out to more providers in those communities. For example, here in Metro Nashville, we have dozens, if not 100 or more providers that still are awaiting their first shipment of vaccine. So that's another way to deal with that excess demand. Instead of just continuing to feed vaccine to the same sites, where they may be tapped out as far as manpower or space, we can increase the number of sites and increase the number of access points to help alleviate some of that logjam. It might be a little messy for the next week or two, but what our priority is getting the most shots out to the most people as quickly as possible, and that might create some more demand, but in the long run, it's going to be the fastest way to get the most Tennesseans vaccinated.
Thanks, everyone. That is our time for today. If you asked questions and we didn't get to you, you may email those to tdhmedia@tn.gov. The link to the announcement we issued is in the chat as well. Thanks so much, and we will talk to you again soon. Good afternoon.